Something I never skip on cloudy days, sunscreen. Every day I wear sunscreen. Well, I put a moisturizer on my face, and when I wash my face, it has sunscreen in it because with repeated sun exposure, even in the shade, you're always having some type of sun damage, or you're always at risk for that. Hello, my name is Dr. Jennifer Tutt. I'm a physician here at PartnerMD in Sandy Springs. And today we're going to talk about UV safety. July is UV safety month, and I'm going to help you understand the importance of how to protect your skin from those harmful rays. I think the biggest misconception is that I'm not going to get a sunburn because I'm in the shade, but you don't have to have burn to have sun damage to your skin. Sun damage or UV damage to your skin is a cumulative. You get a sunburn, we all have had one, you heal, you move on. But what you don't understand is that with repeated exposure, even if it's not with a sunburn, those skin cells can only repair themselves so much. And after getting beaten up so many times, those cells give up and they start to mutate. And when they start to mutate, they go in different directions. And quite often it's in the direction of morphing into a tumor or a skin cancer. You have to make it a point to apply your sunscreen on a regular basis, say every 30 minutes. Just make it a point to do that. Even if the sunscreen is waterproof, those still fail after a while. And so it's just something just to get used to applying on a regular basis. You stop what you're doing to take a drink of water, stop what you're doing and put some sunscreen on. It's important for you to do a skin check probably at least once a month, just like a breast exam, if you will, for ladies and men. It's important to look for, to get to know your moles. It is not uncommon to get a new mole every year of your life, but it's important to know those moles and get used to them. You gotta look at the color, your skin texture, if you will, like check for rough patches, check for sores or scratches that won't heal. Most sores or scratches should heal themselves up within a couple weeks. If you find that you have something that's not healing beyond that time frame, then that should raise a flag.